Hello everyone, my name is Peter and I've decided to document my journey with a knee resurfacing surgery. I was looking on the internet for things like this and I actually couldn't find an experience that somebody would have with the surgery, with recovery and things like that. So today is one day before my surgery. I'm going under the knife tomorrow. I am a little bit scared, a little bit excited, and I really hope for the best. So I just wanted to share with you how I got here. So, or how my knee got here, I should say. As a child, I had a ski injury where I twisted my knee. It was pretty painful. Didn't do much about it. Eventually got better. My knee got better, and everything was just fine. And I twisted my knee again, actually boogie boarding on a beach at about when I was about 25. And again, after a few days, things went back to normal. But ever since then, I had some pain in my knee here and there. And it kind of gradually got worse and worse. And eventually, after I saw an orthopedic doctor, they told me that I have a torn meniscus, and eventually I went for a meniscus surgery, and that was in 2016 or so. I actually don't remember anymore, but roughly. And so after the meniscus surgery, my knee really didn't get much better. I did physical therapy, which is really important, but uh, it I felt some improvements for about after the recovery, say 2-3 months for the recovery, and then another 3 months after that, I felt things were better. But then, kind of things started going back to my knee being painful, my knees swelling again. So my friends recommended a surgery, but I was actually trying all possible alternatives first. So I actually heard about this stem cell therapy. So I did the umbilical stem cells therapy, stem cell injection, plus a PRP injection in 2019, at the end of 2019. And that actually I felt for about 6, maybe 9 months, I felt really good. I mean, the knee felt good. I thought, yeah, this is finally working. Unfortunately, after those 9 months, I started having pain again, started having swelling again, and things essentially got worse very quickly. Uh, so I decided at the end of 2020, I decided to go for their knee replacement surgery, and I talked to a few friends, and they actually suggested Dr. Pritchett, and that he does the knee resurfacing surgery, which is a little less drastic than the full knee replacement surgery, but pretty much, you know, uh, those two surgeries are very similar from what I heard. So not a big difference between the two. I feel that the knee resurfacing keeps little bit more of my knee in place, so hopefully it's going to be less taxing on my body. So I'm going for the surgery tomorrow, uh, and if you like, why why am I going for the surgery? So you kind of heard the journey, how things happen. So why am I going there? So I pretty much all the time these days I have pain and swelling in my knee. When I go skiing, after an hour or so, I'm pretty much done. And I don't ski. I used to ski like double black diamonds, and nowadays I'm just on blues and maybe single black diamond. And after an hour, my knee starts to hurt, and I can go for another 2 hours with pain, and then I pay for it later because the knee swells so, and it hurts. And usually after things like this, I just take 3-4 pills of ibuprofen, so 60 to 800 milligrams, and then ice my knee, and in a few days, knee is kind of back to the okay, you know, level. Uh, so I mean, I still until recently, I did a little bit of skiing, a little bit of ice skating, hiking, uh, but all these activities, they are painful. Uh, Surprisingly, even sitting after a long time, uh, sitting, the knee starts being painful as well. So, the good advice here would be don't sit for extended period of time. Try to move every hour or so. Try to stand up, walk a little bit, move your knee at least. That's helping me. Uh, and after sitting, standing up is the difficult part. Just the first few steps with my knee are painful. Uh, and the activities I cannot do, running or squats. And because of that, I think like any strengthening is really difficult. And so both my knees are getting weaker and weaker. And now it started showing up on my other knee, on my left knee as well. So the muscles are getting weaker. Uh, the other leg started to hurt as well. So I decided that I really have to do something before, you know, I need surgery on both knees. Hopefully, just by fixing the right knee and strengthening both knees, things will be good again. So, a few things I wanted to share with you. Like if you look at my knee, my physical therapist told me that my knee looks like a 70-year-old person knee. This is the bad knee. You can see, even though I didn't do really anything for the last 2-3 days, my knee is just constantly swollen. And that's essentially not good. So this is the good knee, this is the bad knee. The other thing I wanted to show you guys is this knee brace. I bought it on Amazon. This is the brand, and I had a few knee sleeves and things like that, and they usually just restrict circulation, but they didn't. I felt like they didn't really help my knee that much. So uh, let me show you how to put it on. So you just kind of put it from the back of your knee. There is a hole. You strap it on. There's another hole. Strap it on, and this just holds my knee in place. And in fact, it really helps me to do all these activities that I mentioned. Like without the brace, I would start being in pain very quickly. Like with the brace, uh, I still get I still get in pain, but it's much later. So I can do more with the brace, and it's kind of helping me to survive till the surgery, and hopefully I won't need it after the surgery. And actually, I to be honest, I use it for both knees. So that's that. Uh, in the next video, I will talk a little bit about what to do before surgeries, about exercises, things like how to use crutches and things like that. So, yeah, wish me luck with the surgery, and I'll talk to you soon.